Hi, everybody. Welcome to another episode of Xenex podcast. Today, we're very pleased to have Adam Perkins, CEO of Tucson, Sierra Tucson, with us. To get started, Adam, why don't you talk about what Sierra Tucson does and your role within the organization?
Yeah, thank you. My name's Adam Perkins. I'm the Chief Operating Officer at Sierra Tucson out here in Tucson, Arizona. And Sierra Tucson is residential. We have a little bit of inpatient, of course, but residential rehab facility for people suffering from addictions and mental health issues and that kind of thing. Sierra Tucson's been in business for about 41 years now, and we have a very deep clinical understanding of these issues that people are kind of dealing with in their lives, and some of the increased pressures, of course, with social media over the last few years, and how that all works into it. So I'm happy to be here. Kind of feel like I'm standing on the shoulders of giants that have come before me.
Yeah. So, Adam, that's a very interesting sector as it relates to healthcare, but that also talks about trust that you have to establish between the patients, the providers. How do you establish trust in an environment that's very regulated, and at the
Yeah.
same time you have to push the technology in order to bring efficiency? So, is there a challenge in balancing that and creating trust within that environment?
Yeah, absolutely. A lot of, I would say a lot of the work that we do with patients before they arrive here is just helping them to understand what this environment is. I would say the majority of them, maybe 60% or more, have never been to any kind of rehabilitation type of facility. They've never been to a residential facility. Some of them, of course, have, and they're coming back for a tune-up, and that's great, and we love to have them. But, as far as the technology and the trust is concerned, all of our providers, they're all licensed, they're all clinicians. We have medical providers, of course, and therapists of all levels. And the trust that we establish really begins before the patient gets here, and helping them to understand what to expect when they get here, so that way there's no surprises once they arrive. We get them checked in, we have their initial psych evals, and just kind of help them to transition well into this environment, so they can kind of forget the fact that they're here necessarily, and they can focus on the work that they're here for, which is really trying to understand themselves and how they interact with the world and why they make the decisions they make. So hopefully they can, we can put them on a path to making different decisions and help them to be a little bit happier and successful in their lives.
So you mentioned a few things that brings up privacy and HIPAA, but more than just regulatory compliance, what came to my mind as you're explaining what you do is it's really important to keep that information about the patient very confidential.
Absolutely.
And of course, there's always the issue of, how do you do this with the technology, and how do you make sure that information does not get out? So what do you do to secure that information, privacy, and, to show that the patients are protected and the data is protected and everything is kept very confidentially, given that everything is electronically out there?
Yeah, absolutely. Like other systems, we're on electronic electronic health record, right? EHR, and all of that is encrypted and all of that is protected. We're fortunate to also have a parent company, Acadia, that helps us to keep all of that IT-related information in a protected status. One of the things that has come up over the last few years is AI. And how do we leverage AI technology to help us in these interactions with our patients? And even a number of years ago, when I was going to my primary care, he would have an AI scribe that would listen to the conversation between the doctor and I, and then transcribe that interaction into the chart. And of course, all of that's locked down as far as IT is related, and protected information. So that's all part of the IT security side. It's not exactly my expertise, but just helping the patients understand as they come in that their health information is protected. Sierra Tucson has a history of taking some pretty high profile people throughout our country and other countries that come here for this specific purpose. And so we want to be able to ensure that their identity is protected, their health information is protected, and thus far we've done a pretty good job of that.
So, when we look at your ecosystem, you've got doctors, contractors, providers of different kind, as well as insurance companies, payers, and that's a large ecosystem.
Yes.
And I suppose in your environment, you already have all of these connected, right, in your own ecosystem.
Correct.
What does it mean in terms of supply chain and efficiency that you bring in to that ecosystem, as it relates to healthcare and as it relates to being a profitable business?
Yeah. That's it's funny you bring that up because I literally just came out of my last meeting had to do with the business of providing clinical oversight and to our employees even. And how do we provide for that time and for the efficacy of that training to make sure that it's good, high quality training that people are getting something out of. And so when we talk about the healthcare industry, it is still a business and we are still a for-profit business. And so we track everything, we look at everything, we look for efficiencies and economies where we can. But at the end of the day, we also have to protect the clinical product that providing to the patients that are coming in here for that product. And so we always try to think of, from the patient's perspective, when they come in our doors, when we pick them up at the airport even, how are they being treated, how are they being interacted with, to the extent that they're getting what they're paying for, respectfully, or the insurance is paying for, so we can provide them that kind of feedback and treatment in the most economical way for us to be able to stay in business and continue to offer these services for the next 40 years. So a lot of tracking, a lot of data, and a lot of conversation. We, of course, there's a lot of Teams meetings that happen, but we also try to get together intentionally in person so we can have that human connection as well. Because I think having that human connection and understanding where are you coming from, what's your perspective, and help me understand that so that we can look at the whole picture and try to come up with the best solutions that we can as a team.
So it sounds like you've got a very high touch business. And what does HIPAA and privacy compliance requirements impact your operations? Is this something that's blocking your ability to move forward quickly, or is that something that's actually beneficial and it helps you control the environment better?
Yeah, that's a really good question. Some of the struggles that we've experienced, and I experienced this in other organizations, is the heaviness of the use of email. And for example, if we have something happening that needs to be addressed sooner rather than later, and there's an email sent, well, in addition to the other 150 emails that I get today, that information is somewhere in there that I may not get to till either later tonight or maybe tomorrow, kind of thing. And so knowing this and having these experiences, we've looked for products in the market that allow us to have more open, immediate conversation and interactions with our teams that is still HIPAA compliant. And so one of the products that we're using right now as a trial is called Tiger Text. And that's hospital-based technology that's HIPAA compliant and encrypted, so that way we can speak openly amongst each other, the staff members, to get things done for these residents as they come in or as things happen. And so, as I'm sure as you're aware, in this kind of environment, someone could say, you know what, I showed up, I can't do it, I gotta go. And, kind of get cold feet and want to bail. And so we want to be able to get in front of them and be like, hey, look, remember why you're here, right? And so we want to be able to provide those services because they've made the sacrifices to get here in the first place. In some cases, flying from across the country or leaving their children with other loved ones so they can come and work on themselves. And so we need a way amongst each other, the staff, to be able to talk quickly and openly about what's the situation that's happening, who can intervene, who can help, what does this patient need, what can we provide. So it's been pretty good.
I love that example because, I always talk about purpose-built products and solutions that does not, it's not an impediment to what you do on a daily basis, but actually enhances the
Yes.
environment. How you,
Yes.
and that was an excellent example. And to that extent, when I think about AI, you mentioned AI and how AI is being used, particularly in healthcare, and the speed by which AI is penetrating every business and automation of certain tasks.
Yeah.
If you had a crystal ball and you looked into the future and you say, okay, this is what I think is going to happen with AI, and at least with our business, what would that be?
Yeah. It's hard to say. I mean, a number of years ago when we started doing telehealth, kind of like this meeting that we're having now over the computer, there was a lot of patients that were reluctant because there was missing that human interaction, the human, like being in the room together, patient therapist. And in this case, then we had patients on our providers on a computer screen interacting with a patient in a facility somewhere. So there was a lot of reluctance towards that. And as AI has come on the, kind of front and center over the last few years, it's not inconceivable to believe that in the future, therapy could be very AI heavy. As far as, do you actually know that there's a human on the other end of the computer, or are you talking to a machine? And those are ethical questions that I think in the healthcare field we really need to consider. Because I know that the providers that we work with, that I've had the pleasure to work with for many, many years, they're all very ethically centered, as they should be, of course, because they have this license to provide care to people. So the question really does become, with AI coming in the future, where we are now and where we conceivably could be in the future, is can we guarantee that that's a human on the other end, or are we talking to the machines? So those are things that we really need to just be sensitive to over the next few years, that healthcare continues to adopt AI technologies.
It's really amazing you say that because I was talking to another CIO, COO in a healthcare organization, and he was saying that people now go to one of the AI machines, like a chat GPT, and
Yeah.
they ask their healthcare question,
Yes,
and they're getting responses, and although some of it is accurate, but it's not necessarily good for the patient because it may not be accurate.
correct, correct.
Are you
And
seeing
that's,
the same thing?
well, not necessarily, but I do hear about these things anecdotally, even to the extent that our children, our youth, are on their phones with these AIs and they're interacting as if they are friends, and they're building these relationships with AIs that is not necessarily healthy. And we're not necessarily seeing positive outcomes to that. And so that's also another legitimate concern as far as therapy is related. If people are going to ChatGPT versus having the courage to have a one-on-one conversation with a human or show up in person and those kinds of things. So, I don't know, it's a very sensitive topic. So,
Yeah, it is. It is. I can understand that. Let's talk about supply chain a little bit, right? In every organization, supply chain these days has become really complicated because you don't know where the service is coming from. For example, if you have a service delivering you some, let's say you click on an application and the data comes in for you. So you're looking at something, but that data could be 3 or 4 levels deep before a service provider in the cloud is actually collecting the data, and therefore there could be a lot of vulnerabilities along the way before that application gets to you, and those vulnerabilities could be used by bad threat actors, and that could potentially cause compromise in the network. Are you concerned about the speed by which the technology is moving, and yet some of these issues have not been resolved at all? Because I talked to a lot of CIOs, COOs, CFOs, and supply chain is always a big issue for everyone. So the question is, how concerned are you about the effectiveness of supply chain today and in the near future, let's say in the next 12 months?
yeah. Yeah, no, that's a really good question. Well, like I said, I'm not an expert in the IT side of things. I do know, in working closely with our IT person here on site, is we have remote servers for the company. And so even if we hit print on one of our screens, it's got to go to 4 or 5 states over to a physical server somewhere else before it gets processed and then sent back. And that does and has had an effect on our operations at points. And we're not just talking about printers, but also our EMR that is also cloud-based. And so, as we think about downtime and downtime reporting and that kind of thing, it always comes back to paper. It's like that's our little insurance policy. Effectively, when the technology goes down, we've always got paper, and we've got people here on site that can process all of those kinds of things. And honestly, I think that just kind of like we were talking a minute ago, that human interaction, the human component, is still critical to the success of these technologies that we're using moving forward. Because as the technology either fails or becomes corrupted or whatever the case is, we still have a service to provide. And that's always going to come back to the people here on site that are providing those services.
And what does that say about your um, i- telehealth and other services that you're providing? And how do you feel that the technology is going to change that? And first of all, bringing efficiency, but at the same time, opening a can of worms? Is that something that's a possibility?
Oh, definitely always a possibility. We, who was it? Richard Bronson, in one of his books, I feel like it was Business Strip Bare, he talked about the example of when they were building their airline. And they had never run an airline or anything like that, so they hired the best people that they could from their competitors, and then they talked about what can go wrong, and then built systems to protect against that, right? So in our case, as far as the technology is concerned, for our internet services, we have 3 independent redundant systems. And so if one goes down, it automatically switches to the second. And if for some reason the second goes down, we've got the third. You know what I mean? And so that's as much as we can, as reasonable as possible, I would say as well. You build redundancies into these systems that allow operations to continue when and if there's a failure. And then at the end of the day, you lose power, we back up generators, we've got paper EMRs, I mean, all of that kind of thing. So you have to kind of forward think and say, what are the things that could go wrong, and then how do we prevent against it once it does? So,
Yeah.
proactive.
So if you had, you've been doing this for a while, you're an executive, um, if you had advice, if you were going to provide some advice to some of our listeners, and they're either in the healthcare field or they're actually executives like you, but they want to learn from you, what advice would you give them for today and for tomorrow from an executive view?
Yeah. Yeah, I would say you have to protect the business. In some cases, I've been around to see that the numbers are not adding up. And if the numbers don't add up, it doesn't matter how much we care about the product or how much our physicians or our therapists care about the work that they're doing. If we're not making money, we're going to be out of business. I mean, that's just 101. So know the numbers. You have to know the numbers. And with that, with having an open and kind of a clear expectation around that and understanding from the clinical side, from the operational side, what are the things that we can do to increase the numbers while also protecting the clinical product? Because that's what people are buying, respectfully, in our business at least. And so you have to protect the core business. And if you're doing that, then most executives like myself and even up the food chain, they'll back off a little bit so we can focus on providing the clinical quality that people are actually here to consume, if you will. So understanding the numbers, staying flexible, I would say, is also a big one. Especially in this market that's changing so quickly, like with technology and AIs and that kind of thing. There's some companies out there that, and there's some people out there really even that are really, they've got their roots, they've got them dug in deep. And, being able to be flexible and nimble and flex and change and try new things quickly. Those are all qualities that will help keep a company moving forward. So that's a
Yeah.
little bit of advice I would think I would give.
No, it's it's very interesting because when I talk to some of the people, they don't actually bring up the numbers, know the numbers. That's
Yeah,
a well said. You got to know the numbers. You're in business. You want to make sure it's a profitable business, so
correct.
know the numbers. I'm going to use that, by the way. Know the
Yeah,
numbers.
go ahead.
And when we also look at the talent and management of the talent, getting the right talent.
Yes.
How do you see the environment changing? How does that impact healthcare? How does that impact your business?
Yeah, no, that was the other thing I was gonna say, but numbers are really the most important thing. Second to that, though, are the people. Exactly what you're saying. It's the talent. You've got to have the right people for the right reason at the right time. And, when you come into an organization and you're getting pushback, I would say, or inflexibility, there's an old, the I Ching talked about, in one of the verses of the I Ching, it talked about the flexibility of youth and how they're eternally flexible like a river flowing. But when we die, we're like a dry reed and we snap easy, because we're inflexible. And so when you run into people who are inflexible, that's not what you need. What you need on your team is people that can understand concepts and ideas and flex to those ideas so we can continue to move the business forward, as we spoke a moment ago. But higher, and this is the other thing I would say is corporate life is not like it used to be. Like 80s and 90s, you had these corporate training programs and you had these facility training programs, and this was a big thing. With corporate trainers, and you pay thousands, tens of thousands of dollars and train up your staff and that whole thing. At the speed of this economy, there really isn't time for that anymore. And one of the things that we really look for anymore when we're doing executive recruitments or director recruitments is who's been there, who's done that, who's gotten over the emotion of it all, and who can deliver a result. That's what we're looking for. So when we go into our hiring practices, we're looking for people who have got that experience. They've done it, because we don't have time to train. We need to hire a person who knows what they're doing, hit the ground running, and let's get these results.
So it brings me to a question. My last question is, or topic, I should say. Having said that, what's the dynamics that's effective in executive team, that is the C-level, that they're talking about the direction of the company? What's your role and other executives' roles? What's that dynamic that you have experienced in a healthcare organization that makes it successful? What works and what doesn't work? Can you shed some light based on experience and
Yeah.
what advice you have?
Yeah. I think the most important thing that any executive team can have at a facility, at a corporate office, is clarity on the North Star. Where are we pointing the ships? Give us a direction. What is the North Star that we're looking for? And in the executive team is executive alignment. How is each one of these executives contributing to that North Star goal, right? Short of that, there's dissension, there's misunderstanding, there's the choice of offense, right? I didn't like the way that this email was written, or I interpreted it like this, or whatever. It's like, if you assume positive intent because we have clarity on our goals, that's step one. Clarity of the goals of the organization. So when we go into a strategic planning meeting, close those doors, and we're there, and you hash it out. I just came out of a meeting. It took 45 minutes to get to the 5-minute solution. There's a lot of emotion involved. There's a lot of passion. That's why we hire people. There's a lot of experience. There's a lot of risk management, of course. But once you got that definition and everybody's rowing the boat in the same direction, that's when you can see big things happen. And big things can happen quickly because you have alignment. So I think from that perspective, that's the hard leadership, because it's not going to be for everybody. When that direction is set and that messaging is sent out through the organization, there's going to be people that are upset. They're like, this is not what I signed on for. This is not why I hired in. That's okay. That's okay, because that's the direction this organization is going. So let us help you get to your next safe place, so that way we can bring on somebody who's on that boat with us.
Yeah, I love that answer. The North Star, and knowing what you're looking at every time that you send something or you do something. Is it aligned? Do you have alignment with that North Star? I love
That's
that.
it.
And with that, Adam, I want to thank you for joining us today. We've reached the end of this podcast. Thank you for your insight, and thank you for participating. I'm sure our audience will enjoy listening to this podcast, and hopefully we'll have you in another podcast in 6 months or 10 months from now, so we can see how the business has evolved and reflect back on this conversation.
Brilliant. Thank you, Kevin.
Thank you very much.